So today, we're going to dive into a medical revolution that's totally changing how we see heart disease. I mean, imagine going from looking at these blurry, kind of uncertain shadows of the heart to reading precise, actionable numbers. We're talking about a massive shift from guesswork to certainty, and it all starts with one simple but really powerful question.
Okay, so let's start with a puzzle that has honestly stumped doctors for years. How is it possible that a patient can have chest pain, go get a heart scan, and the result comes back looking normal, but they're still at a huge risk for a major cardiac event? And this isn't some rare one-off thing. It's a really dangerous blind spot in a lot of traditional heart imaging.
And that blind spot is exactly where our story begins. You see, it all comes down to a fundamental problem in how we've always looked at blood flow in the heart. It's really a problem of perspective.
Think of it like this. Traditional scans, like what we call SPECT imaging, they basically grade the heart on a curve. They look at the best supplied area of the heart muscle and compare it to the worst supplied area. Now, here's the problem. What happens when the entire heart is getting poor blood flow? Well, in that case, the scan might still look totally normal because there are no standout bad areas to compare against. It's the classic case of missing the forest for the trees.
This right here nails the fundamental shift. The old question was all relative. Is this spot worse than the spot next to it? The new question, which we can now answer thanks to Quantitative PET or QPET, is absolute. It's how much blood flow is this area actually getting? We're not just comparing neighbors anymore. We're getting a precise, objective number for every single part of the heart.
So, how exactly does QPET pull this off? Well, it does it by giving us cold, hard numbers. And that's the core of this whole revolution. We're turning pictures into hard data we can actually use.
The first key number is myocardial blood flow, or MBF. This is really the foundation of the whole technology. It's not a guess, it's a direct measurement, in milliliters per minute per gram of heart tissue, of exactly how much blood is reaching the muscle, both when you're resting and when you're under stress.
Now, building on top of that, we get to the most powerful metric of all, myocardial flow reserve, or MFR. The best way to think about this is as the heart's ultimate stress test score. It's a super simple ratio that tells us how well your entire coronary system can ramp up blood supply when you need it the most. See, a healthy heart can crank up the flow like crazy. A diseased heart just can't.
And this number, this is the one that really matters. An MFR score below 2.0 is a massive red flag. It means the heart can't even double its blood flow when it's put under stress. This one little number is an incredibly powerful predictor of future heart problems, and it helps us find high-risk patients that the older scans would have missed completely.
Okay, so that's the theory. But let's look at the evidence. How does this newer PET technology really stack up against the older standard, which is called SPECT? I mean, the data really speaks for itself, doesn't it? When you're talking about accurately spotting a significant blockage in an artery, PET imaging is hitting 87% accuracy. SPECT? Only 71%. That 16-point gap is huge in medicine. It means fewer misdiagnoses and a lot more people getting the right treatment way sooner.
So why is PET so much better? Well, it really comes down to the tech itself. The physics behind it just allows for higher resolution and way better signal correction. That means it's more specific, which leads to fewer false alarms. And, super importantly, it gives us much clearer, sharper images, especially in tough cases like with obese patients, where SPECT scans can often be blurry and hard to read. The real-world impact of this is just staggering. Get this. In a really high-risk group, like heart transplant patients, an abnormal PET result was tied to a 3-fold increase in the risk of a major cardiac event. And the abnormal SPECT scan? It showed no significant link at all. That is literally the difference between catching a deadly problem and being completely blind to it.
Now, beyond just finding blockages better, QPET is also solving medical mysteries that have frustrated both doctors and patients for decades.
So, think about this really common scenario. A patient has chest pain, they go in for an angiogram, and the doctor comes back and says, "Hey, great news, your major arteries are totally clear." But the pain just keeps happening. For years, this was a huge mystery. We now know that almost 2/3 of these cases are caused by something called coronary microvascular dysfunction, or CMD, a disease of the tiny blood vessels that normal tests just can't see.
And this is the real game changer. By measuring that myocardial flow reserve we talked about, QPET can positively identify CMD. It's no longer a, well, we ruled everything else out, so it must be this kind of situation. No, it's a specific, data-driven diagnosis that finally gives patients an answer and gives doctors a clear target for treatment.
But the applications don't even stop with blood flow. The power of PET actually extends to other complex heart conditions, letting us see the heart's health in completely new ways.
You know, after a heart attack, some of the heart muscle might look like it's just dead scar tissue. But is it? Using a special kind of tracer, PET can actually see if that scarred tissue is still metabolically active, if it's still viable. And that is an absolutely crucial piece of information when you're trying to decide if a big procedure like bypass surgery is actually going to help.
PET can also go hunting for inflammation. In diseases like cardiac sarcoidosis, the body's immune system basically attacks the heart by mistake. By using a different tracer that's drawn to those inflammatory cells, PET can light up these problem areas, often long before any permanent damage is done.
And getting these inflammation scans right takes incredible precision. I mean, to make sure the tracer only goes to the inflamed cells and not the healthy heart muscle, patients have to follow this incredibly strict protocol. We're talking a high-fat, low-carb diet for 2 days, a long fast, no exercise. It really shows you just how sensitive and specific this technology has to be.
So where does all of this lead? What's next for this incredible technology?
Well, a big part of the future is in developing even better radioactive tracers. The ones we have now, like rubidium-82 and ammonia, they work well, but they have their limits. The new tracers coming down the pipeline are being designed with longer half-lives and even better accuracy, which promises to make these powerful QPET scans even more precise and, hopefully, more widely available.
The trend is crystal clear. All the major medical organizations are recommending PET more and more in their official guidelines. New tracers are going to make it easier for more hospitals to offer it, and AI is already being used to analyze the mountains of data these scans create, making the whole process faster and even more accurate.
But really, if there's one thing you take away from all this, it's this. We are moving away from an era where doctors had to make subjective calls based on fuzzy images. We are now entering an era of objective, data-driven heart care, where a single number can give a definitive answer. And that empowers both doctors and patients with a level of clarity we've just never had before.
So, we've gone from shadows to numbers. Technologies like QPET are pushing us into a future where a diagnosis isn't about interpretation anymore, it's about facts. And it leaves us with a pretty provocative thought, right? What if a single number could truly define your heart's health and guide its entire future?